We're up at Ramsey College Hospital. With me is Peter from Vannin Healthcare. You may be Dutch, but you're actually based here, and you've been here some time, Peter.
That's right, that's right. So I said in my speech I tried to copy the Manx accent after 12 years old. That never succeeded, never will. Never will.
It's fascinating. This is claimed to be a British Isles first here today, what we're seeing here with this Easy Sense device. Tell us all about it.
Yeah, it is. Early Sense is an innovation. It's a product, as many products we have in our portfolio. And what is the unique feature of this product? It is detection of the patient's vital signs under the mattress. So this is a detector you put under the mattress, under a thick mattress, and it detects crucial vital signs and new vital signs that never had been detected, like the respiratory rate. And nowadays we get a little bit older, you and I, yeah? Nowadays you call it fancy artificial intelligence. I call it logical thinking. You just put all the parameters together, so there is a massive database who links up the heart rate, respiratory rate and moving of a patient. And that's not just an innovation what's available now today, but since 2004 it has been developed. What does it do? It links all those parameters together and it predicts certain pathologies. What is one of the major issues we can detect, what nobody can, is early sepsis detection.
That's a big one now.
That's a big one. I'm pretty long in this business, and I said before it was cardiovascular disease and nobody cared. But when you call it stroke, wow, stroke, that's a major issue, and also, of course, also for the health system, because you try to avoid to get a stroke. You don't want to have a patient sitting in a wheelchair for 10 years and the rest of his life. But sepsis is one of the major issues. 70 million people die a year in the world.
So your detectors, the unique selling point here is that you're not strapped up, wired up.
Correct.
You lie on the bed.
Correct.
There's a sensor under there. You might sit in a chair. There's a sensor under there. Immediately, all the nurses have access to that information.
Correct. So the unique thing is that it's Wi-Fi, it's wireless, fully secured under all the directives of the health system. The data goes in the database and will be projected here in Ramsey at the 3 different workstations. So they have 31 beds, 3 workstations, and there are 3 large LED screens without patient information, of course, and you can see exactly what is going on 24/7 a day of the patient.
Is this replacing medical staff or assisting medical staff?
It's very interesting. That's a good question. It isn't. It is really make life more pleasant. And I say, look, I couldn't show one of my slides. I had the chance myself to work together with the nurse in Ramsey, and that is quite interesting. We are in 4 continents, not to fly to Azerbaijan this time, but go over the mountain road to Ramsey and work with the nurses. What I found and what I put in my slide as the first one is staff satisfaction. And that's a very important part. In 5 years' time there will be an immense shortage, already there is, of nursing staff. And what we have seen, that nurses said, my God, we finally have time to talk with the patient and not running around like chicken to treat them. So the staff, I think specifically for the Isle of Man, it's an immense asset. We put the Isle of Man on the world map, Early Sense, because it's the first in the British Isles. We beat in the UK big time, what I love, being a semi-Manx man. And secondly is that you can prevent so many pathologies, etc. And chaos costs money. Chaos, last minute work costs money. So you can really act before something significantly happens. But staffing, no, it won't replace nurses. But you have certain hospitals, for instance, in the Netherlands, where they run entire department with 2 nurses. Now you can run it comfortable and not being stressed, etc.
So this has all been privately helped out, funded, isn't it, by the League of Friends here? Do you see that you've got the minister on board? Is he going to put us into Nobles Hospital?
We already had David Ashford immensely on board. He was a big advocate of us. Of course, it took 2 years.
Can you get him to pay for it everywhere?
Now, look, the thing is, it's very simple. We talk a lot in healthcare nowadays, and I'm a clinician myself. If a cardiac surgeon would act like King's Fund and all those talkers, the mortality rate will go up with 70,000%. I'm just joking, You have to do something. Prevention is needed. Out-of-hospital care is needed, but how do you do it? I come from a country, when I heard all the stories in the UK and the NHS, integrated care already exists for 40 years in the Netherlands, when I was a little boy. So we know how it works. So just copy a model and go for it, But I believe that with the statistics we have, and are already proven in Ramsey, it is of course a political issue by how do we sell the Isle of Man. I think that's already worth the money. If you put the Isle of Man on the roadmap to include Nobles and all the clinics, the nursing home with early sense, and sell it as the first total digital healthcare island in the world, you will blow the world away and we will be world news. And it's probably far cheaper than an advert campaign by the Department of Enterprise. You understand? But I believe, speaking about the cost saving we can generate is immense. I heard some stories lately that, and it came in the news, you know more than I do, some sepsis patients were not quickly diagnosed. They ended up 8 months in Liverpool. And if you end up 8 months in intensive care unit in Liverpool, it costs the health system £500,000. You only need one patient is 50% of the purchase price of here. So the prevention, but also let's think about the elderly people and also the patient satisfaction, the staff satisfaction, etc. So the combination, I'm long in this business, I haven't seen a product where you have a combination of all those factors. Patient safety, early detection, better care and cost saving.
This is not a test product, this is actually officially, and you're rolling it out elsewhere, and this will be common. Yes. In a couple of years' time, in most places?
We think this will be a new standard in the world market, healthcare market.
And a Manx company technically behind it?
Yeah. That is what we try to do now. And then we are also proud about this, and that's the reason why we have been fighting to get it in. Mm-hmm. The problem is what I've seen, and I've been myself involved in 86, 87 in the early days by establishing a large corporation in the UK. The NHS has changed, yeah. But I mean, there are certain things we have to realize. Aging population is not an NHS problem. Aging population is a global problem. And why do certain countries already attacking this years ago and we're still talking about it? Let's think, what are we going to do about this, you know? But I believe early sense is a fantastic basis and foundation of a new type of healthcare. Integrated care, what I mentioned. That we come now with the new telemedicine, so the doctor can see the patient in Ramsey when there is something wrong. The nurse calls the doctor, he logs in, he sees the patient and he decides Nobles or not. What you had before, let's send it to Nobles because I don't want to take the decision. And that is cost. That is massive cost. And we don't think about it. An immense distraction for the patient. Yeah?
Well, it's been fascinating. And we talked about your company another time and what you're doing here in the Isle of Man. But you're obviously pleased with what's happening here today.
I'm very pleased today. I'm very pleased that for many reasons to do something, to give something back to the Isle of Man. I think we are, call it an overcomer. Yeah. But I mean, we
get
are.
The accent in the end.
Yeah, but I try to. It's funny, I speak 6 languages, but I have the Dutch accent everywhere, Spanish, German, etc. and so on. Right. But I mean, I think also as a company on the Isle of Man, and we're not in finance, we are in the medical business, but it's a little bit awkward, no? You're a strange duck in the pond. But I believe that as a company you also have a social responsibility. And we see really what we love. Of course we made some money out of it, that covers our cost. But we are so proud and happy to give something back to the Isle of Man. And that is my final story I want to tell you, and hope to see you again.